Hi, Callie Yanta here to talk again with contractors who are building Planned Parenthood's new regional headquarters in St. Paul. First of all, a quick follow-up to yesterday when you heard from post-abortive women. I went to Planned Parenthood's own website where they say, quote, serious long-term emotional problems after abortion are about as uncommon as they are after giving birth. I am sorry, but from my experience with women who've had abortions, some of them my very close friends, that is not true. I have one friend who said she can't even think about it, let alone seek counseling or go on a retreat weekend for healing because she wouldn't come out of it alive. I have other friends who don't know that I know they've had abortions, and I've heard that they are suffering so tremendously that they think God is punishing them in various ways for their past choice of having an abortion. And that's not true. And my fear is that those friends think that I would judge them because I am so out there with my pro-life stance, and I wouldn't. Those who know me know that I lived a prodigal daughter lifestyle in the past, and I could have easily wound up in the same position and made that choice myself. I just didn't happen to get pregnant. So I'm not here to judge. I am sending these messages because I don't want another woman to endure that kind of suffering ever again. And the question that comes to mind is why? Why is there such deep suffering following most abortions? I think it comes down to the fact that at some point after the abortion, it could be years or decades later, a woman comes to terms with the reality of what actually took place in that abortion clinic. Dr. Anthony Levatino used to perform abortions. He describes the most common procedure, the suction D&C, which takes place up to 12 to 13 weeks gestation. It accounts for 90% of abortions performed.
Once dilation was complete, a suction catheter would be placed through the cervix into the uterus. This is a suction catheter. This is a rather large bore catheter, more typical of the type we would use for a suction D&E abortion that we'll talk about in a minute. But these come in various sizes. They're all about the same length, maybe about 9 inches in length. They're clear plastic and they have an opening through the end. The tubing is set in such a way that it can be freely rotated, and also it can be moved backwards and forwards so that the entire inside lining of the uterus is suctioned. The suction is powerful enough that the baby is literally torn to pieces by this machine. One of the risks of the suction D&C abortion is that tissue would be left behind. This could cause bleeding, it could cause infection, or I've even heard of situations when women had their abortions, then went home and had some cramping 3 or 4 hours later, a little bit of bleeding, and looked down on a couch and there was a little arm sitting there that had been left behind.
The second most common procedure takes place in the second trimester and requires stronger instruments. It is called a dilation and evacuation abortion, or D&E.
What you really need now is a strong enough clamp to accomplish the abortion. The one we typically use is called a Sofer clamp. This is a grasping instrument, and when it gets a hold of something, it does not let go. Now, D&E is a blind procedure. It runs a higher risk to the mother, definitely for that reason, because now the uterus is larger, the walls are softer and thinner, and you have to be very careful not to perforate the uterus or having an instrument go right through the wall. A physician reaches in with a Sofer clamp and basically kind of feels around for anything he can get, because this is a blind procedure. And when you basically got a hold of something, picture yourself pulling on this clamp hard, and I mean really hard, and suddenly it lets go, and out pops a leg that big, which you put down on the table next to you. And you reach in with the Sofer clamp again through the cervix, being careful not to perforate the cervix. And again, picture yourself kind of reaching around and kind of grab anything you can and cinch down on that clamp and pull hard, really hard, and when it suddenly lets go, out pops an arm about the same length, which you put down on the table next to you. And then you put this clamp in again and again, and you tear out the intestines, the spine, heart and lungs, all coming in pieces, and then dumped on and put on the side of the table. Then you get to the hardest part of a D&E procedure, which is the head. Because the head on a baby that size is about the size of a plum, and now it's floating free within the uterine cavity. You'll know you did it right, and again it's blind, but you have to reach in and you'll know you did it right when you've got your clamp around something and your fingers are spread about as far as they're going to go. And you'll know you did it right if you crush down on the clamp and if some white material runs out of the cervix, you know you did it correctly because that was the baby's brains. And then you can literally pull out skull pieces one by one. And if you had a bad day like I did a lot of times, sometimes a little face comes out and stares back at you. Congratulations, you just accomplished a D&E abortion. You just affirmed her right to choose. You just made $600 in 15 minutes cash.
And I don't remember a lot, but two things I remember is this incredible cramping and this feeling, this almost like a vision or a daydream or a dream, because I don't know if I passed out or not, but is this sense that there was a little one with its fingers and hands grabbing on and holding on and saying, "Mama, please don't let him take me." And I remember having that sensation. And the jar started to fill up. And I remember looking over and I was sort of confused as to what that was, and then I realized it was the baby's remains, and it was blood, and it was just filling up. There was so much, and I was like, oh my God, that can't be all coming out of me, and it just filled up and filled up and filled up, and it was completely full, and then it was done.
Jill was 21 weeks along. Had she waited just 2 or 3 more weeks, she would have required a partial birth or intact dilation and extraction abortion.
Most babies at this stage are in breech position, which is perfect for this procedure. If they're not, whether they are or not, a grasping clamp, like a Sofer clamp for instance, would then be introduced into the uterine cavity, and basically an attempt is made, sometimes using ultrasound for visualization, to grab at least one of the lower extremities or legs of the baby. This is brought through the cervix, and once we've got at least one limb, preferably a leg, coming through the cervix, then the baby can be pulled down through the cervix. Intact now, this baby is all in one piece, and then nothing else has been done to hurt or kill this child at that point. The leg is gotten a hold of and brought down, and the baby is delivered through the cervix up to, but not including its head. Now this is very important from a legal standpoint. If the head pops out through the cervix, and certainly if the head pops out through the vagina, you now have a person under the law, and you have a very difficult problem in terms of legalities performing an abortion or killing that child. So it's very careful in a partial birth abortion. You need to deliver the baby, arms, trunk, legs, trunk, both arms, right up to the point where the head is still within the cervix. At this point, a pair of scissors called Metzenbaum scissors, these are long, slender scissors that are standard scissors that are used in surgery, but a pair of Metzenbaum scissors is then introduced through that little space that you've got where you can see the base of the skull, and those scissors are stabbed into the back of the skull or jammed into the back of the skull, and then spread to make an opening in the base of the skull. Then a suction catheter again is used and placed, in this case, through the opening in the skull, into the brain. And then the suction machine is now turned on, and that same powerful suction that we can accomplish an abortion all by itself in early stages is now directly located inside of the brain of this baby, 24 weeks of age or older. And when that suction is applied, of course, the brain is sucked out through the tubing into the suction machine, and the head gradually collapses because it's still very soft. Once the head, now the baby's dead, of course, and once the head has been collapsed, then and only then is the baby delivered through the cervix. Personally, all abortions are barbaric. This one is particularly barbaric.
One of the arguments for abortion is that a child in the uterus, a fetus in the uterus, is so small, especially in the first trimester when most are aborted, that it wouldn't be viable. It wouldn't be able to live on its own, and so therefore it's not technically a human being yet. But my contention is it's just in another stage of life. We were all babies at one point. We all became toddlers and then adolescents, teenagers, and now adults. Someday, hopefully, we'll be among the elderly. Life in the womb, that baby is just at another stage of development, like we all go through, and needs to be protected. So please, please think about the future women who will be hurt here after you leave, the babies who will be killed here after you leave, and know that this is not your typical job site. I'll be back tomorrow with message number 3.